Basal cell carcinoma, BCC, is the most common form of skin cancer. It arises from the basal cells in the outermost layer of the skin, the epidermis. BCC is typically slow-growing and rarely metastasizes, spreads to distant organs, but it can be locally invasive if left untreated. Standard of care treatment for BCC aims to completely remove the cancer while preserving the surrounding healthy tissue. Common treatment options include surgical excision. The primary treatment for BCC involves surgical removal of the cancerous lesion and a margin of healthy skin. This is often curative, especially for early-stage BCC. Mohs micrographic surgery. Mohs surgery is also used for BCC. It is particularly beneficial for BCCs located in cosmetically sensitive or high-risk areas. Mohs surgery involves peeling away one layer of skin at a time and is more exact than traditional surgery. Electrodesiccation and curettage. This procedure involves scraping off the cancerous tissue with a curette, a sharp instrument, followed by electrocautery to destroy remaining cancer cells. It's commonly used for small, low-risk BCCs. Cryotherapy, liquid nitrogen, is applied to freeze and destroy the cancer cells. It is suitable for superficial BCCs. Topical medications. In some cases, topical creams or gels containing medications like imiquimod, Aldara, or 5-fluorouracil, Efudex, may be prescribed for certain BCCs. Seriousness, compared to other cancers, BCC is generally considered less serious than many other types of cancer. It is associated with a very low risk of metastasis, meaning it rarely spreads to vital organs, and the overall prognosis for BCC is excellent, especially when detected early and treated promptly. However, BCC can be locally invasive if neglected, causing disfigurement and damage to surrounding tissues. In the US, over 4 million cases of basal cell carcinoma are diagnosed every year, yet it results in very few deaths. Subtypes of basal cell carcinoma BCC is not typically categorized into stages like some other cancers due to its limited ability to metastasize. Instead, it is often described in terms of its clinical or histological characteristics. Here's a simplified overview of how BCC is sometimes categorized. Superficial BCC. This is a common type of BCC that is confined to the top layer of the skin, epidermis, and the upper part of the dermis. It is often considered an early stage and is highly treatable. Nodular BCC. This type of BCC forms solid, raised nodules or tumors within the skin. It may be slightly more invasive than superficial BCC, but is generally localized and treatable. Infiltrative BCC. Infiltrative BCC may be more invasive, growing deeper into the skin, but it typically remains localized and rarely spreads. Morphiiform BCC. This is a less common subtype of BCC that may be more difficult to treat due to its subtle, scar-like appearance and potential for deeper invasion. Metatypical BCC. This subtype may have characteristics of both BCC and squamous cell carcinoma, SCC, another type of skin cancer. It is also considered a localized cancer. Promising therapeutics. While BCC is primarily managed through surgery, there have been developments in the use of targeted therapies and immunotherapies for advanced BCC. Vismodegib, Erivedge, and Sonidegib, Odomzo, are FDA-approved targeted therapies for advanced BCC, especially in cases where surgery or radiation is not feasible. Immunotherapies, such as cemiplimab, Libtayo, have also shown promise in treating advanced BCC. One promising integrative treatment for BCC is the off-label generic antifungal drug itraconazole. This and many other integrative treatments are described in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. Risk factors for developing basal cell carcinoma: ultraviolet, UV. Exposure. Prolonged exposure to UV radiation from the sun or artificial sources like tanning beds is a primary risk factor. Fair skin. Lighter skin types, particularly those with a tendency to sunburn easily, are at higher risk. Age. BCC is more common in older individuals, but it can occur at any age. Personal or family history. Having a history of BCC or other skin cancers increases the risk. Weakened immune system. Individuals with a weakened immune system, such as those with HIV/AIDS or undergoing immunosuppressive treatments, are at higher risk. Organizations and resources. Several organizations provide information, support, and resources for individuals affected by BCC, including Skin Cancer Foundation, offers educational materials, patient resources, and information on skin cancer prevention. American Academy of Dermatology, AAD, provides information on skin cancer detection and treatment, as well as a directory of dermatologists. Melanoma Research Foundation, MRF. While primarily focused on melanoma, MRF provides valuable information on all types of skin cancer, including BCC. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.